Hi, this is Dr. Antelak from thegentlendentist.com. We're located in Shelby Township, Michigan. Our phone number is 586-247-3500. And what I'd like to talk to you today about is the use of lasers in dentistry. Right now we use what's called a soft tissue laser. It's called a diode laser. A diode laser is this unit here. It's a very small device. And what it does is it uses the energy in the form of light to, and it uses water as the source to carry it, and what it does is it helps to vaporize soft tissue around an area that we might be working on. So for example, we use these disposable tips, and it goes right here on the unit itself, and then we can dial in the amount of energy that we want to put into the soft tissue area. This is light, so what it does is the light energy goes through this little tip here. We all use special glasses. For example, the patient and the assistants wear these yellow glasses to protect their eyes. And for me, I use it looks like a pink colored glasses that fit just on my loops here. What it does, it protects our eyes from the energy from the laser. But the benefit of using lasers is that they're really very atraumatic, we call that. So it doesn't create trauma within the soft tissues. Sometimes we can actually go ahead and use a laser without using any anesthetic at all. On this unit, it has what's called a comfort zone, which it actually pulses, and that pulse energy will actually reduce any discomfort that a person may feel. We use these when we do crown preparations. Rather than packing that cord that goes around the teeth, which can actually create trauma, we use this to create a small little microscopic, just a small little trough around the tooth. So when we put the impression material in it, we can do that. And actually, on my wife, I had a couple of crowns to do on her. I did one side where I packed the cord, and then I did the other side where I used a laser, and she said the laser side was much more comfortable for her. So I definitely wanted to use that as a kind of an experimental thing, and it definitely is true. It is much more comfortable. We also can use this when people are, we call tongue-tied, where the tongue, where there's an attachment, an extra attachment that goes to the tip of the tongue, and we can use it for infants. When infants actually, when they nurse, if they can't get their tongue out far enough, then they can't properly nurse. And also for, as we get older, if our tongue is retained down into the floor of our mouth, sometimes doesn't give it the natural appearance. So what we do is we just use, there's a little attachment of soft tissue that we use to just remove that little area, and it will free the tongue up. We can also use it for the top lip, where the lip attaches to the gums here. We can use it when we remove lesions. For example, if we need a biopsy, we can take a little lesion around that might be caused by trauma from biting, possibly, and we can just remove these lesions with very little trauma. The laser actually has the zone of where it functions. It's very narrow compared to other different sources. For example, using a scalpel blade to remove something, or what is called an electrosurge. An electrosurge is like that, except it uses wave energy versus light energy to create little troughs of removal. So also, this is also good for, since we place implants, dental implants, it's good for removing the soft tissue around an implant as the implant is exposed, so we can create that to make crowns and that type of thing. So we use the dental laser, the diode laser, all the time in our office, and once again, it's a way that we can use to create ideal dentistry, state-of-the-art dentistry in an environment where we try to really focus on your comfort and care. So this is Dr. Antelak from the Gentle Dentist, and so our phone number is 586-247-3500 or thegentlendentist.com. Thank you.